Lifestyle medicine is a branch of medicine. It's a subspecialty where we focus on intensive therapeutic lifestyle changes to prevent, treat, and sometimes even reverse chronic disease. So we focus on 6 different pillars in lifestyle medicine. The first one is nutrition, so a nutritious diet. It's a whole food, plant-forward diet, a high-fiber diet, focusing on lots of fruits, vegetables, whole grains, lean proteins, and healthy fats. The recommendations are for 150 minutes of moderately vigorous activity a week, 30 minutes, 5 days a week. Moderately vigorous activities where we can talk but not sing. So it doesn't have to be anything fancy. You don't have to be huffing and puffing. You don't have to be dripping sweat. Something like a brisk walk could satisfy that. Ideally, you'd have 2 days of resistance training, weight training, to help maintain muscle mass. The next pillar would be restorative sleep. For adults, we need 7 to 9 hours of quality sleep a night. So a consistent wake time is the most important, and then you count back 8 hours. So if you're going to sleep 7 to 9 hours, you need to be in the bed 8 to 10 hours. The next pillar is stress. So stress is also super important. I mean, in today's times, we have so much information. We have such a busy life. We always are going, we're always doing, we're always think we can do more. It's super stressful. Even just driving across town to get to your doctor's appointment is stressful. So I think most people don't realize the effects of the stress. I found a lot of chronic, deep-seated childhood stress, childhood trauma from a younger age that I don't think patients really understand the effects of. Chronic trauma increases cortisol. We already talked about how cortisol makes it impossible to lose weight. It raises your blood pressure. It affects your sleep. The next pillar would be avoiding risky substances. Tobacco and alcohol are huge in our country. These things, I mean, everybody knows tobacco affects your pulmonary disease, emphysema, lung cancer. It's a huge contributor to heart disease. Alcohol also affects liver. It's a huge contributor to cancer and heart disease. The last pillar is social connection. So I don't think people realize that we have an epidemic of loneliness in our country, this social isolation. I think everybody realized that in COVID, but it was pervasive even before COVID.